My name is Dr. Eric Chehab. I'm one of the sports medicine surgeons here at Illinois Bone and Joint Institute. I specialize in knee and shoulder injuries. So some of the most common knee-related conditions for endurance athletes and long-distance runners are tendinitis around the knees. So it's common to get what's called a patellar tendinitis, which is inflammation along the patellar tendon, which is a band of tissue that runs below the kneecap into the shin. And it's one of the main tendons that allows your quadriceps muscles to pull and extend your knee. When people have a patellar tendinitis, they'll typically have pain in the front zone of their knee. They will have difficulty running, jumping, going up and down stairs. The pain is very focal over the tendon itself, and it can be very disruptive to runners' training. It can make it very difficult to train. Fortunately, the treatment works, and the treatment is typically physical therapy with a focus on what are called the eccentric strengthening exercises. Eccentric exercises are where the muscle is getting longer, but it's still under tension. So one of the common names for eccentric exercises are negatives. But anyway, those type of exercises, patellar tendinitis responds to quite favorably. And patellar tendinitis is also a condition that responds favorably to a four-letter word for athletes, which is rest. So when endurance athletes or long-distance runners develop a tendinitis, they do benefit from rest, but that's obviously difficult to do when you're in training and you have an event coming up. But it will help you get better more quickly. So we do recommend an investment in rest for patients with patellar tendinitis in combination with the physical therapy. In terms of the most common knee injuries that we encounter with long-distance runners and endurance athletes, injuries to the meniscus are the ones that we are most concerned about. And typically if patients have a meniscus injury, they'll have pain that's pretty focal in the knee. It'll be in a spot. They'll have swelling in the knee. They might have some catching in the knee where they feel like something's grabbing in the knee or getting locked in the knee. Meniscus injuries can be treated without surgery, and patients get better with time. The meniscus tear doesn't necessarily heal itself, but it can right itself with time. But it's also reasonable to consider procedures for meniscus injuries that where we can either trim the meniscus that's torn, it's almost like trimming a hangnail from your hand, or doing what's called a meniscus repair if it needs to be sewn together. Usually if there's a meniscus repair going on, it's a larger fragment of meniscus and the symptoms aren't that subtle. There's usually a significant episode that can be remembered, and there's locking of the knee and there's difficulty bending and straightening it. So the meniscus repairs are far more common in patients who have a more dramatic presentation, a discrete injury, a feeling of a ripping sensation, and inability to fully straighten out the leg or to bend it. But most meniscus tears in the endurance athlete or long-distance runners are more degenerative in nature, and they cause these small fragments that get caught in the knee. And those small fragments can be trimmed surgically, or with therapy and time, those small fragments tend to disintegrate and dissolve and sort of whittle away over time. A meniscus injury, for those that do require surgery, the surgery is quite successful at alleviating symptoms. Now, there can still be long-term implications of having a meniscus injury, primarily of developing arthritis over time. And it's not that everybody who has a meniscus injury develops arthritis, but people who have a meniscus injury are at higher risk for developing arthritis as they move along and get older. The advantage of a meniscus surgery is that it helps symptoms more quickly. People will feel better more quickly, can resume training more quickly. The disadvantage of a meniscus surgery is simply the risk of having a procedure, which in this case is very, very low. The most common complication of a meniscus surgery would be infection, and that's quite uncommon. The most common unfavorable outcome is persistent discomfort in the knee. And again, that's not common either. But when we look at unfavorable outcomes after meniscus surgery, which again is not a common thing, the most common unfavorable outcome is persistent discomfort. The worst type of outcome would be an infection, which is very, very rare. So a lot of people with knee pain ask, when should they come in for an evaluation? So I think there's several circumstances where it's worth coming in for an evaluation. Number one, if you're having pain that is just not resolving. So if it's lingering week after week after week, or it's progressing week after week after week. Another reason to consider an evaluation if the knee is swelling. So swelling in the knee can be a sign of there being injury into the knee. It can also be a sign of overuse, but usually we can tease that out. And then lastly, if the knee feels unstable, if it's giving out, that's another good reason to see a physician for evaluation if you're training for an endurance sport or training for long distance running. So swelling, pain that's progressive, and instability, those would be the big three reasons to see an orthopedic surgeon if you're having trouble with the knee.